Honorable Dr. Norman Dunn, other specially invited guests, ladies and gentlemen, children, if any, good morning. Jamaica joins the global initiative, the global campaign, in raising awareness for antimicrobial resistance, and it's important that we seize the moment in doing this so that we can become prudent users of our antimicrobials. And so it's a pleasure to be serving today as your moderator. My name is Georgia Thompson, and we will go through the proceedings. We will go through the proceedings as is. So, ladies and gentlemen, since 2015, Jamaica has been making strides in putting together a national antimicrobial resistance plan to guide our efforts as to how it is that we will move our country forward in spreading this awareness as to how it is that we will deal with our antimicrobial agents. We have many stakeholders in this initiative, thanks to the Ministry of Health and Wellness.
Sorry, can you restart? Because the minister was outside, so just restart everything.
Was permission granted? Honorable Dr. Norman Dunn, other specially invited guests, ladies and gentlemen, good morning. My name is Georgia Thompson, and it's a pleasure to be serving as your host for this in celebration of World Antimicrobial Awareness Week, under the theme Preventing Antimicrobial Resistance Together. Since 2015, Jamaica has been spearheading the move to put together a national antimicrobial resistance plan that will aid our efforts not only in raising awareness about AMR, but in terms of stimulating everybody else about the prudent use of our antimicrobials. Truly, AMR is a global concern, and Jamaica is not exempt from this, and so this initiative is a welcomed one. So, ladies and gentlemen, we will proceed with our program this morning. And now I invite the Minister of State in the Ministry of Industry, Investment and Commerce, Honorable Dr. Norman Dunn, to bring us greetings.
Good morning, everyone. I was hoping we'd have prior. And not so quickly, Professor Nicholson. Dr. Georgia Thompson, moderator, Mr. Ian Stein, PAHO WHO representative. I'm not sure I see Dr. Watson, Osbill. Oh, Dr. Watson, right there. Chief Veterinary Officer, Ministry of Agriculture and Fisheries, Dr. Lynette Peters, Director, Veterinary Public Health, Ministry of Health and Wellness, Dr. Elizabeth Johnson, Inter-American Institute for Cooperation on Agriculture, IICA, Professor Nicholson, and I see here Dr. Bigona Shagastu, more or less. Tamara Moore, FSPID. So one of my fellow pharmacists and other distinguished persons, both here and possibly online, good morning. I'm pleased to join other individuals and our global development partners and friends to observe World Antimicrobial Resistance Week. This global health and development threat requires urgent multi-sectoral action, and the Ministry of Industry, Investment and Commerce remains committed to the process of due diligence to protect our local and international consumers. The strides we continue to make in manufacturing, agriculture, and growing the productive sector could be severely hampered if our efforts not to strengthen, to reduce the exposure to pathogens such as bacteria and chemical residue along the value chain. This includes, of course, the sale and consumption of food, for which there are several international guidelines on trade to inform Jamaica's legislative and regulatory response. The National Compliance and Regulatory Authority, NCRA, the Bureau of Standards of Jamaica, PBCJ, the Jamaica National Agency for Accreditation, JANAC, and the Food Storage and Prevention of Infestation Division, FSPID, are all agencies under this ministry, the Ministry of Industry, Investment and Commerce. Each is, however, charged with specific responsibility to safeguard Jamaica's trading reputation while advancing appropriate safety, sanitation, and hygiene standards. We work tirelessly to inspect and test foods and animal products at all our storage facilities, manufacturing and retail facilities to ensure safety and wholesomeness of the foods, including feed intended for commerce here in Jamaica. Additionally, our regulators provide training and certification to pest control operators. We also collect samples to conduct laboratory analysis on food for resistant pathogens, contaminants, or pests that can harm our agriculture sector and our people. This information is then disseminated to relevant stakeholders in pest management and best food safety practice to be upheld. Internationally, our agency, JANAC, is playing a lead role. On June the 14th of this year, 2022, it was recognized as an accreditation body by the United States Food and Drug Administration, FDA, under the accredited third-party certification program known as TPP. JANAC now has the authority to accredit certification bodies to conduct food safety audits under 10 of the 11 possible scopes. And that's a big thing. JANAC is one of the 4 FDA-approved accreditation bodies globally and the sole such entity in the English-speaking Caribbean. This FDA recognition is a game changer, as certification bodies accredited to this new scheme can conduct food safety audits and issue certification to food facilities. Certification received from JANAC accredited certification bodies can be used for expedited entry into the United States for products, and once deemed eligible, to participate in the Voluntary Qualified Importer Program known as VQIP. This is a key development in the ministry's thrust to ensure the world has safe food to consume and to export. According to the World Health Organization, at least 700,000 persons die each year due to drug-resistance disease. Their research projects that drug-resistance disease could cause an estimated 10 million deaths each year by 2050, and damage to the economy as catastrophic as the 2008-2009 global financial crisis. By 2030, antimicrobial resistance could force up to 24 million persons into extreme poverty. If health systems are burdened, individuals become increasingly strained and the productive sector will become stagnant. The World Bank estimates that unless action is taken, the volume of global real export could shrink by an estimated 1.1% in the low-case scenario and by 3.8% in the high-case scenario. The negative impact on animals would significantly affect food production and food security, and farmers therefore creating a pronounced global increase in severe poverty and in unemployment. The Ministry of Industry, Investment and Commerce urges all Jamaicans to continue to apply those health and safety standards which save lives during COVID-19 pandemic to your everyday life. Practicing good hygiene and keeping our crops and animals healthy must become a way of life for all of us. The ministry will continue to work closely with local and international development partners, ministries, departments, and agencies of government to ensure that food is produced and that is produced in Jamaica is fit for local consumption and export. Ladies and gentlemen, I would like to wish you all a successful World Antimicrobial Awareness Week. And I'm sure the sessions and the talks by various persons will be beneficial for us to learn more. And I know Dr. Nicholson, who is one of the foremost authority here, I am dying to hear what she has to say. Good morning.
Thank you, Minister Dunn, for your message to us this morning. Truly, addressing AMR as a concern here is not a one-man band. And so we thank you for your commitment and that of the agencies under your portfolio, sir, in this initiative. Ladies and gentlemen, coming to bring us greetings now is the Chief Veterinary Officer at the Ministry of Agriculture and Fisheries, Dr. Osbill Watson. Dr. Watson is a veterinarian by profession and has been working assiduously in this global initiative. Ladies and gentlemen, welcome Dr. Osbill Watson.
A very pleasant good morning to all. Honorable Minister Dunn, Professor Nichols, other dignitaries from PAHO, from ICA, from other ministries of government. I wish you well this morning as we all continue to share information as it relates to how we can work together in this crisis. As was outlined, the theme of the World Antimicrobial Awareness Week for 2022, preventing antimicrobial resistance together. Hence, so many entities, Minister, have come together to join forces to attack this problem once and for all. We are all aware that animal health, human health, and environmental health are inextricably or intrinsically linked. And so we share the environment together. We share the environment, both humans and animals and plants. And as such, we share the pathogens that can cause diseases in both humans and animals. And we're aware that in excess of 60% of pathogens that cause human diseases originate from animals, whether domestic or wild animals. Antimicrobial resistance has become one of the greatest global health challenges of our time, and also has become a leading cause of death. It is a threat to animal and human health, as well as livelihoods and food security worldwide. We are aware that worldwide, approximately 1.3 billion people rely on livestock for their living, and a further in excess of 20 million depend on aquaculture for their livelihood. In understanding AMR, we look at what antimicrobial agents are, and I will leave that further detail to our colleague, Professor Nicholson, but at my level, I will say that from what I know, these antimicrobial agents are naturally occurring, semi-synthetic, or synthetic substances which exhibit antimicrobial activity. So they either kill or inhibit the growth of microbes. Anthelmintics, which are used to treat intestinal worms, gastrointestinal worms, and substances classified as disinfectants are, as far as I understand, excluded from this definition. So at the global level, the mitigation of antimicrobial resistance is crucial for the protection of human, animal, and environmental health. The indiscriminate or injudicious antimicrobial use is a key driver of the promotion and spread of AMR in companion animals and in livestock. According to the CDC, up to 50% of antimicrobials are unnecessarily or inappropriately prescribed in human medicine. And this percentage is probably the same for companion animals, dogs and cats. As it relates to livestock, farmers use antimicrobials in several different ways to maintain animal health and increase productivity. And I know that we here in Jamaica, and I speak from the facts, we have been championing the cause to remove antibiotics from the food chain, particularly as growth promoters, far way in advance of what is happening here. I can recall getting requests for persons importing antibiotics to be used as antimicrobials, as food additives, and we indicated, we at the Ministry of Agriculture say, no, we're not in this thing. And they come at us to say, well, it is used in North America and it is used. So yes, but this is Jamaica. And I'm happy that the world has come full circle to follow Jamaica's footsteps in removing antimicrobials from the food chain as much as possible. And as it relates to the use in livestock, therapeutic use, which involves the treatment of sick animals due to pathogens, yes, that is justifiable. Metaphylactic use, treatment of both healthy and diseased animals, especially in a group of animals that only a few become ill, but there are some healthy ones in there, and antibiotics are used right across in the group. Prophylactic use for disease prevention, growth promotion of course, which I indicated no, because that would be adding antimicrobials into animal feed or the water to promote faster or more efficient livestock growth, and we say no to that. In 2019, as an example, over 11,000 tons of antimicrobials were sold for use on farms in the United States alone. The responsible use of antimicrobials and proper disposal of the unused portions and expired drugs ensures that we safeguard the environment as much as possible and reduce the risk of development of resistant microbes. In the field of veterinary medicine in Jamaica, the Ministry of Agriculture and Fisheries has been working with stakeholders, including farmers, veterinarians, animal health technicians, medical doctors, academia, to prevent diseases in animals through vaccination programs and the implementation of relevant measures such as disease surveillance and farm biosecurity. We must remember that companion animals, especially cats and dogs, they play an important role in our lives, but they also play an important role, or they can play an important role in the development of AMR in relation to carriage and transmission of these resistant microbes to humans, because they are very close to us. Pets can be reservoirs for resistant microorganisms, particularly when infections are not completely treated. And we are aware of drug-resistant bacterial pathogens that have been found to originate in cats and dogs, like Staphylococcus aureus and others, Enterobacteriaceae, and others. Therefore, fighting antimicrobial resistance is a global issue and must be addressed through a One Health approach. And I'm happy that over the past few years that we have all been working together, thanks to our collaborating agencies such as PAHO and ICA, the Ministry of Health, the Ministry of Industry, Investment and Commerce, the private practitioners, whether they be veterinarians or medical doctors, the pharmacists, and all stakeholders, because we here in Jamaica are serious about putting a dent to this global challenge. I thank you very much, ladies and gentlemen.
Thank you, Dr. Watson, for your input and helping us to be more informed about Jamaica being prudent users of antimicrobials. Thank you, sir. Your comments were really enlightening. Thank you. Ladies and gentlemen, I now invite Ms. Shauna Brandon, Project Liaison for Agriculture from the Inter-American Institute for Cooperation on Agriculture, to bring us greetings. Ms. Brandon?
Good morning, Honorable Dr. Norman Dunn, Mr. Ian Steen from PAHO, Dr. Osbill Watson, Chief Veterinary Officer, Dr. Nicholson, who was just sitting in front of me, and ladies and gentlemen in the audience, and if you are online as well. I am bringing greetings on behalf of the ICA Jamaica representative, Dr. Elizabeth Johnson, who expresses her regret at not being able to deliver the closing remarks to you this morning. But at the same time, would like to congratulate PAHO and its partners for a very informative and timely series of events. The Inter-American Institute for Cooperation on Agriculture, ICA, adds its voice to the call for greater awareness of and preventative actions for the threat of antimicrobial resistance. As with our partners, this has been a topic of interest for ICA. Accordingly, we have built capacities of officials across these regions to better understand antimicrobial resistance and apply control mechanisms. Since 2015, this has included training in antimicrobial resistance in agriculture, assistance with the development of surveillance plans, and execution of pilot surveillance activities. As an international cooperation agency committed to transforming agri-food systems, ECO's efforts with respect to AMR are concentrated on the food chain, in particular the livestock sector. And you would have heard from Dr. Watson how important the livestock sector is and its intersection with human health. So in this regard, we are assisting governments to develop surveillance plans to collect and test animal and meat samples at critical points of the chain. These surveillance systems are tools that will allow countries to determine the potential buildup of disease-causing microbes in the food chain that have acquired antimicrobial resistance. The information gathered from such surveillance actions will enable the authorities to plan and execute corrective action that can prevent or reduce the likelihood of microbial foodborne illnesses. Antimicrobial resistance is a global and local threat that must be tackled on many fronts: human health and pharmacology, agriculture, and the environment. And it is a classic example of the One Health approach that is needed. ECO also fully supports the systems approach to improve animal health in terms of the right food and best animal husbandry practices. Healthy animals eliminate or significantly reduce the use and abuse of chemicals or drugs, which is a leading cause of antimicrobial resistance. Thus, the theme for the 2022 World Antimicrobial Awareness Week, Preventing Antimicrobial Resistance Together, is an appropriate call to action for improved animal production practices and extremely relevant in our local context. ECO remains committed to contributing to this fight against antimicrobial resistance and looks forward to continued collaboration with our partners here today on these efforts. Thank you. Happy Antimicrobial Awareness Week.
Thank you, Ms. Brandon, and to your team for your contribution in this global initiative. This time I invite Dr. Lynette Peters, who is online. She will be sharing her message with us. And so I invite us all to turn your attention to the screen as we invite Dr. Peters to share with us. Put your hands together, please.
Good morning. Good morning.
Good morning, Dr. Peters.
Are you hearing me?
Yes, we can hear you loud and clear.
Okay. Yes, I must apologize for all these technical difficulties, and with all protocols observed, I would like to just bring greetings as well as a brief message from the Ministry of Health and Wellness as we celebrate and acknowledge World Antimicrobial Awareness Week under the theme, Preventing Antimicrobial Resistance Together. I begin this message from the Ministry of Health and Wellness by in acknowledgement of World Antimicrobial Awareness Week with a quote from the World Health Organization that describes antimicrobial resistance as one of the top 10 global health threats currently faced by humanity. Antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites change over time and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread and severe illness and death. This as a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective and infections become increasingly difficult or impossible to treat. It is estimated that some 1.3 million people die from diseases as a result of antibiotic resistance. At the 68th World Health Assembly in May 2015, a global action plan to tackle the growing problem of resistance to antibiotics and other antimicrobial medicines was endorsed. One of the key objectives of the plan is to improve awareness and understanding of antimicrobial resistance through effective communication, education, and training. 1 week in November annually since then has been used to heighten awareness, and this year it is November 18th to 24. We encourage as many persons to wear something blue during this week in acknowledgement of antimicrobial awareness, even though I'm not wearing blue at this time. The Ministry of Health and Wellness is pleased to be a member of an intersectoral working group that comprises of senior technical officers from the Ministry of Health, Ministry of Agriculture and Fisheries, the Ministry of Industry, Investment and Commerce, the University of the West Indies, with support from the Pan American Health Organization and the Inter-American Corporation in Agriculture. The team has prepared a national action plan that includes surveillance, public awareness, residue testing. And Ms. Brandon just spoke to the extent of the testing that will be done. This week, we would like to focus our attention on the abuse and misuse of antimicrobials in human and livestock populations. And promote the prudent use, technical difficulties, and promote the prudent use to prevent antimicrobial resistance. Antimicrobial resistance is a disaster waiting to happen. This phenomenon will result in the loss of our ability to successfully treat infections in humans and animals alike. It will prove very costly to government to procure very expensive alternative medications. This will result in lengthy hospital stays as well as high morbidity and mortality of both human and animals. The occurrence of antimicrobial resistance could be as a result of the misuse and overuse of antimicrobials, as seen in the widespread practice of prescribing antibiotics, which are only effective against bacteria to treat viral infections, or the indiscriminate use of antibiotics in the livestock as growth promoters. Inadequate practices to prevent and control infections has resulted in the spread of resistant microorganisms across populations. We have a limited number of tests to diagnose infections. Most laboratories, even those in well-resourced settings, rely on the same techniques of 150 years ago. And these are slow and cumbersome and are simply not available in less well-resourced settings. This has resulted in the antimicrobial resistance problem and caused it to grow unnoticed. Indeed, it is time we acknowledge that this is a silent pandemic. Early and accurate diagnosis is vital to helping individual patients, preventing the spread of resistant organisms, preventing the spread of resistant organisms to other patients and providing policymakers with an up-to-date and reliable snapshot of the antimicrobial resistance strain. Other factors contributing to the rise of antimicrobial resistance include lack of regulations, proper guidelines, limited vaccination coverage, and limited knowledge and awareness of antimicrobial resistance. The Ministry of Health strongly recommends this national intersectoral team in their effort to increase awareness of this serious emerging global public health problem of AMR, and some measures we can take to prevent or further delay the occurrence of this disaster. The antimicrobial we are focusing on is mainly antibiotics. The Ministry of Health and Wellness supports and promotes the approach to only treat sick animals with antibiotics on the advice of a veterinarian. Apply good farm managing practices to reduce the exposure of animals to disease agents. And important as well is do not sell animals for food until the withdrawal period has passed, on the average 4 to 5 days. Do not sell sick animals on treatment for food or meat. And on the human side, we'd like to emphasize the use of antibiotics as prescribed. Do not share antibiotics. Be sure to take the full dose of antibiotics prescribed and not stop if you're feeling better after a few days to complete the course. Hospitals continue to adhere to infection prevention and control measures. Food and water safety is critical to prevent gastroenteritis and the need for treatment with antibiotics. And of course, do not dispose of antibiotics, leftover antibiotics, do not dispose of leftover antibiotics in our rivers and streams, so that do not overprescribe antibiotics. And physicians, we say, do not prescribe antibiotics if not needed to treat an infection. Do not overprescribe. Together, as the theme suggests, preventing antimicrobial resistance together, we can and must make every effort to prevent or slow down the global occurrence of antimicrobial resistance, and all countries of the world start the implementation of international standards and guidelines for the responsible use of antibiotics set out by 3 major international organizations: the World Animal Health Organization, OIE, the Food and Agriculture Organization, FAO, and the World Health Organization, WHO. And with the support given by our regional organization, the Inter-American Cooperation in Agriculture, we certainly hope that this initiative of increasing awareness will go beyond this week, where we really acknowledge with the rest of the world antimicrobial resistance being a public health crisis and a disaster waiting to happen, that we will continue to work towards and in our own way try to prevent or slow down the emergence of this public health disaster. I thank you again for inviting the Ministry of Health to participate in this particular session, and I just hope that we will continue to strengthen all the regulatory and other mechanisms to ensure the prudent use of antimicrobials, especially antibiotics. I thank you again for your attention and apologize for the technical hiccups that occurred, and have a good day.
Thank you. Thank you so much, Dr. Peters. Dr. Peters is the Director of Veterinary Public Health in the Ministry of Health and Wellness. Certainly, Dr. Peters, amidst the challenge you shared with us some very good practices that we should not just listen to, but we should apply, and that is what is going to make the difference when we adhere to these principles that you have shared. Thank you again, Dr. Peters. Certainly, ladies and gentlemen, this initiative here in Jamaica, one of our key stakeholders in putting this antimicrobial resistance action plan together is actually the Pan American Health Organization. We can put our hands together for them. They have played a very big role since 2015, if my memory serves me correctly, when we started this initiative here in Jamaica. And so I invite Mr. Ian Steen, who is a PAHO, WHO representative for Jamaica, Bermuda, and the Cayman Islands, to bring greetings.
So allow me to recognize a few of our colleagues that are here together with us. Of course, the Honorable Dr. Norman Dunn, the Minister of State from the Ministry of Industry, Investment and Commerce, as well as Dr. Orville Watson, as well, from the Chief Veterinary Officer from the Ministry of Agriculture and Fisheries, Dr. Lynette Peters, the Director of Veterinary Public Health, and of course our colleague from the Inter-American Institute for Cooperation in Agriculture. Good morning, everyone. So it is sometimes interesting to talk about the elephant in the room, right? When we talk about one of the top 10 causes for concern in health in the world, and yet sometimes it's difficult for us to draw attention to these matters. As we are overcoming this pandemic that we are still suffering, it's important for us to look over the horizon a little bit to say, what is it that we should be focusing on, paying attention to avert the disastrous situations that we have just been dealing with over the past 3 years. And in this context, antimicrobial resistance is one of those lurking monsters that is a particular concern. And yet, I would say, if we ask the person on the street to name what are the big issues of concern in health, international health, and require international collaboration, I'm not sure, in my most skeptical way, that antimicrobial resistance would come to mind. And so there's work to be done, and that's one of the reasons why we're here today. Of course, this work that we have on antimicrobial resistance, and the theme that we have this year, speaks volumes for the collaboration that's necessary between the range of public, governmental, international organizations that we will require the global response for this threat of antimicrobial resistance. The One Health approach, which I think is one that needs to be underscored in this context, it's founded on the often unseen link between human, environmental, and animal health, and it should be recognized as the only means of tackling this menace to society of antimicrobial resistance. It was with this focus in mind that World Antimicrobial Awareness Week was conceived in 2015, and the collaboration around the world sees works on this matter. Ladies and gentlemen, the goal of the week that we are working is to use the health education, training, and communication and other public health initiatives to raise awareness in the minds of individuals, to influence behavior change, a very challenging aspect in public health and work, to stop the progression of antimicrobial resistance in its tracks, work to be done. Another primary objective of the yearly activities is to ensure that in the generations to come, we continue to prevent and treat infectious diseases with safe and effective medicines. So often when individuals think of antimicrobial resistance, we're filled with thoughts related to the inability of antibiotics to treat bacterial infections. But unfortunately, it's much, much more. Imagine a world, an unfortunate world, where harmful bacteria is untreatable, but also viruses, fungi, and parasites as well. I think it's, as I say, it's the lurking monster that's there, and sometimes it creeps into our world. We see some headlines that make some insinuations to this area, but we're not making the links and how close we are to this really challenging situation. It may sound far-fetched, as I mentioned, but unfortunately, I assure you, there are microbes among us who are already having this capacity and are all but willing to share their knowledge with the rest of the microbe community. These microbes are not only those that cause infections in people through interactions with human health, but also in crops and animals, and lurk in the environment ready and able to make their way to humans through food consumption or environmental contact that leads to untreatable infections. I don't want to be too foreboding, but quite frankly, when I think about the range of different things that we should be concerned about, this is one of those items that is both pressing in the middle-term future as well as the longer-term future, and exceptionally important. We also have to recognize that things such as contaminated manure used in fertilizer, human contact with animals colonized with multi-drug resistant bacteria, or the handling of contaminated meats are examples of interactions with animals in the environment that can result in the spread of resistant organisms. News related to climate change and the melting of glaciers, a very topical thing with the recent conversations that take place in Egypt recently. These may not, we may not see the link that it has to these conversations today, but indeed they do, because many of the melting grounds, so the unfreezing the grounds, contain organisms with resistance mechanisms that we've not seen or been exposed to for a long time. And this has stirred even more amongst the efforts amongst scientists in the race against antimicrobial resistance. As colleagues in the room may know, myself and Dr. Joseph are Canadian, and a large portion of Canada, the northern part of Canada, has been known to be, along with the rest of the country, exceptionally cold. The farthest part of our country has typically been permanently frozen. The ground is permanently frozen. But as the ground warms, and as it is, those frozen grounds are thawing and releasing not only a tremendous amount of methane, but releasing microbes that have not been seen before. And so as Canadians, we have our own considerations in our own northern backyard. But these are things that are not going to stay within one place. It's going to affect us all. We've seen how a pandemic can have drastic effects on the global economy. I think it's always interesting when I see these words on paper because it doesn't really feel the tenor and tone and seriousness of the things that we've seen over these past few years. The workforce, the health systems, our lifestyles have all been tremendously affected. Allow us to ask then, what happens if we do not make the right antimicrobial moves now? The overuse of antimicrobials has left an indelible strain on the available agents, and there is a paucity, very few new agents that are being researched or developed by the pharmaceutical industry. And so the time for action is today, it's tomorrow, it's next week, it's this month, this year. To this end, millions around the globe have come together with healthcare workers and policymakers to put forward the practices in place to halt the emergence and spread of antimicrobial resistant infections. The approach seeks to implement programs, policies, legislation, and research within multiple sectors working together to better public health outcomes. This is, unfortunately, one of the other examples that requires international collaboration. And recent history has shown that we don't do so well in this area. And unfortunately, it's another way for me to underscore the lurking nature of this real challenge. The quadripartite organizations, which includes the Food and Agriculture Organization, the United Nations Environmental Program, the World Health Organization, and the World Organization for Animal Health, These 4 organizations have taken steps to address the threat at the human-animal ecosystem interface, and these agencies have helped in providing guidance, increased stakeholder engagement, and have facilitated a more inclusive global response to antimicrobial resistance. This year, a strategic framework for collaboration on antimicrobial resistance was developed by the 4 organizations within the quadripartite. It's a word I don't often get a chance to use except in these weeks when we're talking about antimicrobial resistance. PAHO has been doing its part regionally by the provision of ongoing technical support and training to enable capacity building for antimicrobial resistance detection and surveillance. It is critical that we all support research into antimicrobial consumption in health facilities and development of antimicrobial alternatives through fostered public-private partnerships that ultimately promote legislative action on the responsible use of antimicrobials across all sectors. The work in this matter cannot wait until a crisis. Together, we must take the substantive steps necessary to prevent antimicrobial resistance together. Thank you.
Thank you so much, Mr. Steen, for sharing with us today. Ladies and gentlemen, and for those of us who are joining online, you are curious about what really is everybody talking about? What really is this AMR? And so, if you are expressing that, well, it's time to find out. It's time for deeper insight. Coming to enlighten us now is a founding member of Jamaica's multisectoral team who has been instrumental in putting together Jamaica's National Action Plan for AMR. I am speaking about Professor Alison Nicholson, who is a professor of medical microbiology. So after completing her studies at the University of the West Indies, her MBBS, this stalwart went into private practice for about 8 years. And so after completing the program, she became a consultant at the University Hospital of the West Indies as a clinical microbiologist. And meanwhile, she was actually lecturing the students, medical students at that. And so Professor Nicholson developed an interest in AMR and was one of the first persons to sound the alarm. Hello, something is emerging here as it relates to AMR. And so she has been across the world talking about AMR, and that alone puts her into the spotlight today to share with us. She is here at the UWI regional headquarters, well equipped. Her years of experience makes her qualified enough to share with us today about what is AMR and what are our roles in its prevention. Ladies and gentlemen, I cannot say anything more than to say, help me welcome Professor Alison Nicholson.
Thank you very much, Georgette. I always knew you liked me. Good morning, everyone. I just want to thank the organizers for inviting me to speak on this topic. Yes, I do have a tremendous interest in the field. And just to add a little bit more to what Georgette said in terms of my involvement, after finishing my MBBS, I went to do private practice. And I loved it. Couldn't believe this was work. It was so wonderful. I'd be going to work and saying, yay! And then after about 7 years or so, it began to become really wearying because, well, for a number of reasons. However, burnt out set in, and so I decided to take a break. And combined with that, one of the, unfortunately, two common events, our practice, I shared a practice with somebody else, was held up by somebody carrying a gun, shall we say. And so my partner, who was the person actually on duty at the time, decided that she didn't want to be in this situation, so I was left with the entire practice. And I just felt I needed something else, something a bit more stimulating, not the same old kind of thing. And so that led me to to go to University Hospital just for 6 months to get a break. I was just going for 6 months to get a break, and then I'd go back to my practice. It didn't work out that way. While there, I met the Royal Microbiologist, who actually was the chief microbiologist at the University of London. And he apparently is he was a University Hospital's microbiologist. And so intervention happened. He persuaded me to give up the practice and to come back and to specialize in microbiology. But it was an exciting time. A lot of things were happening in Jamaica at the time, and I was able to see many sides of microbiology, and I haven't looked back. It almost is as if you're not working. Right. Everybody in microbiology I'm seeing there, and they're kind of not looking. Oh, yes, I'm getting a yes over there. Amen. Thank you. Yes, but when you like what you're doing and when it's exciting, it's almost as if you're not working, really. So it's my pleasure to be here with you. I want to do one thing before I start my presentation, so take the time out, please. I want to acknowledge the presence of the dignitaries here, the special persons as listed before, and I want to thank you for coming and acknowledging your presence. Dr. Dunn, I'm going to take liberties with you. Taking liberties with Dr. Dunn because we have worked together at
Exactly.
So I just want to shake your hand and say thank you for everything, but I have not really purpose reason for doing this.
This is a test of it.
Right, no. So I just wanted to show how easy it is for germs to be transmitted from one patient to another. I haven't transmitted any germs.
We'll see tomorrow.
Right, but I just shook Dr. Dunn's hand. Dr. Dunn, can you see? So turn it around for others to see. So it's on my hand, okay? See my hand?
Right.
See my hands, everybody? Yeah.
Minister, you should have seen that coming.
You seeing it? I'm putting a fluorescent light to my hand, and you can see the fluorescence in the areas. And then you can see Dr. Dunn's nice handshake printing out. Oh, sorry. Oh, oops. Right, you can see Dr. Dunn's hand with fluorescent areas coming from his nice handshake with his trusted colleague. And so, Dr. Dunn, to help you, this is what it is. I put this on it because the label is very attractive, and I don't want anybody to be attracted to it. So for your purposes, you could just strip it off when you go back to your seat and look at it. But it's all fake. It's nothing there at all. It's actually a teaching kit. So you can use it to help persons see the transmission of of bugs, and how they pass from place to place. So me just putting my hand here will also have some places as well. But it's easily washed off. It's non-toxic. It's completely non-toxic, Dr. Dunn. I promise you. You know I would never do that to you. So it's completely non-toxic. It's a teaching aid, and we use it at University Hospital to just show persons how easy it is. So if I held on to the door, so those of you who came to the door, you can check me afterwards. I'm sure you have some fluorescence there. All right, so that's not part of my presentation, that's bonus, right? Okay, so what is antimicrobial resistance? This includes resistance to all agents that are active against microbes. So your microbes would therefore include your bacteria, your parasites, your fungi, and viruses. But for the purposes of the talk this morning, because we're looking at antibiotic resistance, I'm going to restrict myself to talking about antibiotics and bacteria. So what does the term mean? I had a patient say to me some time ago, I went to another doctor and he told me that I was resistant to antibiotics. So you can't use antibiotics to treat me. So she was educating me that I must remember when I'm going to treat her that she's resistant to antibiotics, so prescribing antibiotics for her would not work. But that's not really what it means, okay? When we talk about antibiotic resistance, we're actually talking about the microbe that lives in you, the person. So the bacteria in you is what would be resistant to the antibiotics that we use. All right, so it's not referring to you, the patient. It's not referring to the antibiotics themselves. It is referring to the bugs, the microbes that are being treated by these antibiotics and how they can develop tricks to become resistant, so that the antibiotics that treated Neisseria gonorrhea years ago, penicillin, for example, in some places the Neisseria gonorrhea laugh at penicillin. It has no effect because changes have occurred in the microbes, which is a natural progression in life. And so changes occur, and the same penicillin just bounces off the microbe backs like water off a duck's back. So, oh, I'm sorry. I should be changing. I'm so sorry. Sorry, Georgette. Oh, I can look at that while I'm doing this. Okay, so what does it mean for the patient then? It means that the antibiotic normally used to kill the bacteria causing your infection can no longer work because the organism has changed. Now, there was a time when we didn't have to be too worried about this because the pharmaceutical companies were going ahead of us and making new drugs as soon as we needed them, on demand kind of thing. But they're running out of options. The bugs are running out. At first, it was like we were ahead of the bugs, we were on top of this, we have this, we got this covered, and then the microbes drew gear and sprinted ahead of us, then we sprinted ahead of them, and it was a constant race. The microbes have outrun us now. As far as I'm concerned, the microbes have sprinted far ahead, and we are here playing catch-up, trying to figure out how to do that. I just want you to listen to this clip. No? Okay, so I think I need some technical help here. There is a clip somewhere in this, and I'm not sure. Oh. Okay.
So what we ended up building was basically a petri dish, except that it's 2 feet by 4 feet. And the way we set it up is that there are 9 bands, and at the base of each of these bands, we put a normal petri dish thick agar with different amounts of antibiotic. On the outside, there's no antibiotic. Just in from that, there's barely more than the E. coli can survive. Inside of that, there's 10 times as much, 100 times, and then finally the middle band has 1,000 times as much antibiotic. And then across the top of it, pour some thin agar that bacteria can move around in. The background is black because there's ink in it, and the bacteria appear as white. First, you see they spread in the area where there's no antibiotic, up until the point they can no longer survive. Then a mutant appears on the right. It's resistant to the antibiotic, it spreads, until it starts to compete with other mutants around it. When these mutants hit the next boundary, they too have to pause and develop new mutations to make it into 10 times as much antibiotic. And then you see the different mutants repeat this at 100. And after about 11 days, they finally make it into 1,000 times as much antibiotic as the wild type can survive. And so we can see by this process of accumulating successive mutations that bacteria, which are normally sensitive to an antibiotic, can evolve resistance to extremely high concentrations in a short period of time.
All right, so that's from study done at Harvard Medical School, and that's just showing us what happens, unseen by us, but that's going on, and contributing to the emergence of resistance. Now let's take a look at one of the organisms that has changed, Neisseria gonorrhoeae. And this organism is the one that causes claps or leaks, as it's known commonly. And it's thought that this organism is positioning itself to become the first microbe to be ineradicable by antibiotics. I put there the only good thing about this is that this is largely a lifestyle choice infection, but there's actually no good thing about it. But this is what is happening, is the possibility exists. Now, in many countries, as I mentioned before, penicillin would be you could use penicillin to treat Neisseria gonorrhoeae easily. And no, that's not happening anymore. What's happening in our local society, and I will introduce here how important it is for all communities, all areas to be doing their research so you know what's happening in your area. The organisms at University Hospital will be a little different from the organisms at our health center and the organisms in the animal industry. So it's good to let the data do the talking. I have noticed that when you have data, people stop arguing with you. When, when you're talking about opinions, it's my opinion, but I think, and you just pull out the data, argument done. So it's really important for us to develop the culture of research. No matter how small the area is, if you have an idea and you want to prove it, just get together a small group, decide how best can I do this, do your research, record the data, and then you can use that to promote change that you're recommending. And it really, after you get into it, it's not as hard as it sounds, no. So we looked at our organisms here, Joshua and Zinger et al. And there was actually a publication in the Journal of Antimicrobial Chemotherapy, volume 77, issue 1, January 2022. And we looked at the antimicrobial susceptibility of Neisseria gonorrhea. And we looked at isolates from, well, I think they were from the University Hospital and other places. Some isolates were obtained from the Ministry of Health, I believe, as well. And so we found that 100% of the Neisseria gonorrhea isolates were sensitive to ceftriaxone and 99% sensitive to ciprofloxacin. So we're good. We have something we can use, ceftriaxone, and we have ciprofloxacin. However, if you look at some other data here, it's 9% resistant to tetracycline and 3.3% resistant to penicillin. So you would say, hey, that's great. If this is a resistance, then we have this as an option, but not really. Because although it's not resistant, although the actual absolute resistance level is low, look at what is the intermediate sensitivity or intermediate resistance. 52%, intermediate resistance to tetracycline and 75% to penicillin. This means that if you use those drugs, you're really not sure you're going to hit the organism. So you have a creeping resistance happening here, and therefore this is to send a warning, slow down on the use of the penicillin and the tetracycline, which you would have used before without any kind of fear, because the organism is beginning to learn the secret of these drugs, and the treatment might not actually work. So it's important to know what's happening in your local environment. So now we know we have ceftriaxone, it's a winner, and we can continue using that here. But you have begun to get resistance to ceftriaxone in other places. And as I said before, they're running out of options. So what happens if the bug now learns all the secrets of ceftriaxone and ciprofloxacin? We don't have many other antibiotics waiting in line. And therefore, we could be caught, we could be caught with our pants down. Bad analogy. Right, because of that. So it's important. We need to keep an eye on our isolates, and we have sounded the alarm, and we are saying, look, you can't use penicillin anymore because the bug is going to laugh at it. And we were having cases, you use penicillin, patient comes back, doctor not better, and we know why. So basically, I've started out by kind of giving you a picture, and I want to now go on to take a stroll down memory lane. Just take a look at where we're coming from. This is in 1924. Sir Warren Harding was the USA president at the time. His son was playing tennis on the White House lawn and had some kind of bruise or cut. And he developed a staphylococcal infection in the wound, and he died. So the president of the United States in 1924 could not save his son from a simple wound, having just played tennis on the White House lawn. Prince Albert, husband of Queen Victoria, developed typhoid fever and died at age 42 years. Powerful, would have access to all medical resources, but he was not able to be saved by them. And then we come now to Alexander Fleming. Fleming, who along with Florey and Shane gave the world one of the most precious gifts that we have, the gift of antibiotics. And this was first in the form of penicillin. And that is not to say that there weren't other agents that were being used at the time, but penicillin was perhaps the most formalized one with more research, and definitely the one with the most tremendous impact. And persons will remember that when penicillin was first introduced, you probably had one of the largest trials because there was a fire in Boston, I believe it was. It was the time of the war, and they had a football match, the visitors against the locals. The locals lost, and so the footballers were not interested in going partying. But the visitors, as well as the other people who were tired of the war and wanted distraction, went to the nightclub. That was the happening place at the time. A fire broke out because a hapless bartender struck a match near the alcohol. And so the fire broke out and the entire nightclub went up in flames and hundreds died and persons were really burned, severely burnt and so on. So this drug, penicillin, had just been introduced, and so it was a big thing to track the penicillin and take it by different routes to get to the site of the action. I think Merck was involved, the pharmaceutical company involved at the time. And so this penicillin made a tremendous difference because the burns, as you know, responded to the penicillin, and the organisms at that time, the usual skin organisms, didn't have a chance against this new drug. And so it's like, wow, this was the best boost the pharmaceutical company could get because it wasn't something they engineered. They were actually seen as heroes because they brought this drug, people's lives were saved, and penicillin now entered mainstream. This is after penicillin had been knocking on the door and begging to be used in clinical treatment. But this paved the way for them, and so penicillin came on board. Now, penicillin at the time was regarded as a magic drug, and so this, we call it the magic bullet. People would say, well, if you have a headache, use penicillin. If you have this, use penicillin. It was thought to be the universal panacea. However, of course, with time, you realize that this is really for infections. It is good for infections. And this was seen again, the time of the war. You had skin wounds, and penicillin made a tremendous difference. Look at this also. You have this patient here, a little girl, arriving at the hospital almost on the verge of death. And after 14 days of penicillin, look at her, totally fine, discharged and went on to live for nearly 70 years. All right. I'm sorry. Okay, so basically the introduction of penicillin, and by virtue of that introduction of antibiotics. Of course, by now you know that we have spawned several generations, several categories, classes of antibiotics, and they're all being used in different ways, deployed for different purposes, triple used, double used, etc., overused. But we have to admit that the success of many of the advances in medicine has been predicated on the availability of antibiotics. So there are some things that you really wouldn't want to do without antibiotics because the patient would probably die. But you can do them, cover the patient with antibiotics, succeed in the procedure that you're carrying out, and the patient survives and lives to tell the tale. So transplant surgery, for example, a patient's immune state is really down, and you need to be able to cover this patient for infection. Patients with prosthesis, your orthopedic patients, your cardiac patients, your neurosurgery patients, having antibiotics on board is a must for some of these patients. Patients on chemotherapy for malignancies, again, become very prone to infections, and therefore you need to have your antibiotics nearby in case the patient develops an infection. So can you imagine all of these advances that we have made over the years would be lost if we ended up having widespread antibiotic resistance and we didn't have antibiotics to back us up and to help with these patients anymore. Yet, that's where we're at. We're at the brink of basically falling over into the precipice unless something new and dramatic happens. Right, we're about to fall over the precipice with that vehicle there. Now, with increasing resistance, at a point when we probably needed them most, the pharmaceutical companies have fought back by drastically reducing the number of antibiotics that they make. And their story is a credible one. They're saying that once you introduce a new drug it takes probably, 10 years to develop a new drug, and it costs about $800 million. Okay, right. I thought there was a point, but it's not. All right, so takes about 10 years to develop a new drug, and it costs $800 million. And then by the time you bring the drug to the market, in no time, you're getting the development of resistance. And many of us can think of drugs like that. I remember when Cipro was first introduced, it was really a very nice drug. And I'm coming down now because we're accustomed to the penicillin and the penicillin derivatives. And let me just put a plug here for a drug like Augmentin. I have no shares in the pharmaceutical company whatsoever. But amoxicillin clavulanic acid, let me stick to that. Amoxicillin clavulanic acid is a wonder drug. It is a wonder drug. I've used it for so many years, and I still maintain this is one of the great breakthroughs in terms of antibiotics. However, there are drugs that lose their sensitivity very quickly. Ciprofloxacin, another good drug, but resistance emerged pretty quickly to ciprofloxacin. And so, you know, if you are a pharmaceutical company spending that much money and projecting that you now have, you know, this golden cow, only to realize that, you know, the bugs have become resistant and there's no market for your ciprofloxacin anymore. And we are seeing quite a bit of resistance in the lab to many of these antibiotics. I'll show you some of them, you know, as we go along. Now, Arjun Srinivasan, met him at one of our international meetings on infection control, and he actually invited him to Jamaica, and he did come. And let me just stick a pin to say Jamaica is a calling card. It remains a calling card. I've never gone to an international conference and asked somebody to speak, and usually I look for the best. I look for the best speaker, and I go to them and ask, would you like to come to Jamaica? I've never had a no. And it's usually with excitement, and they've come. So we've developed some friends over that. So Arjun Srinivasan came to Jamaica. He actually became the first person to speak out and to declare that, excuse me, that we are already in the post-antibiotic era. When he came, we asked him about that statement. He said he didn't actually say it like that, but the newspaper ran with his statement, and it's been stuck to him ever since. So we organized a breakfast and introduced him to some businessmen, the business community, to see how he would suggest that they partner with us, the scientists as it were, to see how we can put a dent in the progression of antibiotic resistance here. And so he drew their attention to this organism that was resistant. So the R is resistant, and there was only one. This is a Klebsiella pneumoniae, which is a very common organism in the bowel, and it's all over the place, causing different infections. And so to see an organism with this kind of resistance pattern is kind of scary. And that is what he was showing us, right? The particular mechanism of resistance is the production of Klebsiella pneumoniae carbapenemase, which is a hard-hitting enzyme that actually is able to destroy some of the antibiotics that are given to it. But look at our own local example. Female patient in the 40s, saw her on the ward. It was somebody I knew, so we started talking, and she told me about her problem and why she was on the ward. And during that time, she asked if we could, you know, help with some investigations. And this was a urine sample coming from this patient that grew Burkholderia cepacia. And it was resistant to 21 of 22 antibiotics that we put on it. To be very honest with you, some of those antibiotics would not have naturally worked against that organism, but we were desperate. And so we just threw the kitchen sink at the organism, and it was resistant to 21 of 22. It was sensitive to colistin, but that was in the plate because we know that colistin would not have been an appropriate choice for this organism, but we just wanted everything to be there. So even though it was supposed to be sensitive to colistin, it was not something that we would take seriously. So, a phrase that I developed and like to share, in an ironic twist, the antibiotics that kill the bacteria that would kill the patient have now precipitated the evolution of bacteria that can no longer be killed by the antibiotics and will therefore kill the patient. So we are back to where we started almost, where simple infections can kill because they're not so simple anymore because the organisms are not as simple as they were when we started out. Now, Dr. Watson, I really did not know about the problem with antibiotic resistance in the animal industry. I thought the problem with antibiotic resistance rested squarely on the doctors and healthcare. So you can imagine my surprise when I realized that you guys are the culprits. You're bigger culprits than we are. Glad to dodge behind you. But the truth is, I was so surprised. I mean, I kept reading, and I was saying, wow, I did not know that. So farmers love antibiotics too. In the USA figures there, they're using human therapeutic use accounts for 16% of antibiotics. Animal therapeutic use, Dr. Watson, accounts for 14%. Look at the rest. Animal non-therapeutic use accounts for the rest of that pie chart there. My, that's amazing, isn't it? No, this is also further proof of how they love antibiotics. Look at the chickens. Look at the size of the chickens. These are chickens all taken at day 56 in the USA. Let's underscore that, in the USA. This is not happening in Jamaica. Compare the 1957 chicken with the 2004 chicken. Amazing. But I want to pause here to commend our Ministry of Agriculture personnel here. I really was very proud when I heard that at a meeting in the US, and this was an international forum, Jamaica was the only country, correct me if I'm wrong, Dr. Watson, Jamaica was the only country that voted against the use of antibiotics in feeds, is it? As a growth promoter, I think it was. And they stood up against the big, bright, powerful, rich countries and said, no, it is wrong. And I mean, every time I tell that, I get chills. I'm really proud of the animal people. There must be a better word than that. The people in the animal industry who took that stand, put Jamaica on the map. Look at it now. Everybody's coming now to that position. They're understanding now. You remember things like vancomycin-resistant enterococcus. Enterococcus is an innocuous organism, but it can cause bloodstream infection. It can be a nasty organism, mainly because it's not easily treated by antibiotics. You have a few antibiotics that will treat it. If those antibiotics don't work, you don't have many others. And so at first, enterococcus, not enterococcus, yes, we didn't have vancomycin resistance. So enterococcus was, treated by ampicillin augmentin, and then if it got bad, it could be treated by vancomycin. The first case of vancomycin-resistant enterococcus, I think, was identified in Germany, I think it was. How? Through the chickens in the hospital. When they tracked it down, where did this vancomycin-resistant enterococcus come from in this patient? And they did extensive research. They found the vancomycin-resistant enterococcus in the chickens. And that was introduced. It was the same. They were able to type them, same organism. So I remain proud of the Ministry of Agriculture and the fact that they were bold enough to speak truth to power. All right, so this was mentioned earlier, and I'll just highlight it again because among the projected causes of death in another 30 years or so, it's not so far, I can tell you it's not so far. It looks far now. And when you're young, it looks even further. But when you get old like me now, you realize that it's not so far. All right, so in another 30 years, it is estimated that antimicrobial resistance will cause about 10 million deaths. It will be the largest cause. Isn't that frightening? I mean, where did this antimicrobial resistance come from? Way from the back and just zoom past to the top in terms of importance. The second highest cause of death will be cancer, which is a couple million behind antimicrobial resistance. We only have a short time to do what we need to do in order to rein in this problem, and we need to work together for that to happen. So it's serious. It is thought that in that time, the 2050 time, that you will have like an economic loss of about $100 trillion US per year. I cannot even imagine what a trillion is, much less 100 trillion. But that's what you're looking at, and therefore it's important. So what on earth happened? Overuse of antibiotics. We had the med reps coming to us telling us that we must use antibiotics, etc. And we ran with it, not putting in enough checks and balances. Not enough regulations in place. Some places we don't have guidelines. The doctor prescribes as he feels led. And this one prescribes something that is against what the other one prescribes and so on. So we need to come together and make sure that our guidelines work together and that they're the best guidelines we could have. No extra training of doctors to deal with resistance. So your doctor goes through med school. I can tell you how many lectures on antibiotics that doctor gets, but I'm not going to tell you. And then comes out and is let loose with antibiotics. Dr. Toms, raise your hand if I'm going too far. Right? So no extra training of the doctors to deal with resistance. I sometimes feel that there probably should be a module just on antibiotics to talk about the changes that have happened and to provide some guidance in terms of how we deal with it. No extra training of the public to deal with the emergence of resistance, except that in the past couple of years, we've had this forum. So every year we have a week or so, and we do a lot of interviews, GIS, both television stations in the morning, and the talk shows in the day. We've done the rounds, we've met with journalists, we've tried to, I hope journalists don't have a problem with me now, but we met with journalists trying to get them on our side. You know, come, let me tell you, this is really big news. This is happening. We need you to write up on it. And so we provided interviews and so on. And we did get 2 articles on multi-drug resistant gonorrhea. And so we understand that that's the only thing that's going to catch persons' attention. So persons were distracted by the gonorrhea part of our antibiotic-resistant message. Anyway, we were glad we got those 2 articles, and we will continue to work with our journalist friends and plead with them to help us take the fight to the public, educate, so that we can be on the same page. The use of antibiotics in animals and plants, we're addressing that now. And invention, prevention, control, especially of your healthcare-associated infections. That is an area that we are working on now, and we hope that we can continue to work on this, because if you continue to have spread of healthcare-associated infections, then I think you can follow me with the picture. You know, patient comes into hospital, the patient is ill, immune system might not be the best, so the place has to be clean so you don't have persons using hands that are not washed, moving organisms from one patient to another, not having personal protective equipment, not washing the way we should wash. And by now, most persons know the 5 hand hygiene moments and know that if you're going to follow the 5 hand hygiene moments, you better carry moisturizer in your pocket, otherwise your hands are going to look a mess. But you can't compromise on that, because that is what has been proven to break the chain of infection and to reduce spread, so you have to stock up with your hand sanitizer. So we did some research to look at the members of the public, and I'll just share a small bit of it with you. We looked at how they thought about antibiotic resistance in Jamaica. Less than 70% thought that antibiotic resistance was a global problem. About 50% thought that it was a national problem. Less than 50% thought that, just a little less than 50% thought that the same antibiotics would work for all infections. More than 80% thought that it was okay to share antibiotics. So if something was wrong with you, and we get that all the time in private practice, the patient will come in and say, I just want I don't need anything, doc, I just want you to write this prescription for me. Cipro or Augmentin. Yeah, but why am I writing this? Oh, this is what my neighbor had, and she has the exact same thing as I, so just write a prescription for me. So you have to take 5 minutes, and anybody else hearing this who is practicing like that, take 5 minutes out of your busy practice to educate this patient, explain to them about the problem of antibiotic resistance and what will happen if this doesn't stop, and encourage these patients to be seen so that they can get their own prescription or none at all if necessary. More than 50% thought you should finish the course, but I can wager that not that 50% would actually finish it. They thought you should. 14% asked the doc for antibiotics. Only 14% admitted to asking the doctor for antibiotics, but they claimed that in 90% of the cases they got it. And coming from this study, our colleagues from Pakistan picked it up and asked us to collaborate with them, just sending them our questionnaire and so on, so that they could do same, and they actually got it published in a higher index than we did. The journal, that is, sorry. All right, look at the doctors now. They largely were not aware of importance of hand hygiene in antibiotic resistance. You notice that I don't have any percentages up there? Right. It's not a mistake. Some of them were not aware of the importance of livestock industry in ABR, and as I said, freely admitted, I didn't know. I really didn't know that the livestock played such an important part. They did see antibiotic resistance as a global problem, though, and they saw it more of a global problem, less of a national problem, and definitely less in their practice. Most doctors did not like external controls. They didn't want you to tell them like a pre-packaged, don't do this, don't do that. They wanted the freedom to choose their antibiotics. And most doctors did not like to de-escalate. So if they started the patient on Meranem, they wanted to keep the patient on Meranem, even if the result came back saying that the organism was sensitive to augmentin. And their reasoning was, if it ain't broke, don't fix it. So the Meranem was working just fine, leave it alone. Excuse me. So we have I think we have dented that a bit because we've been, plugging away at this for a while now. And I'm pretty sure that the doctors' attitudes towards antibiotic resistance, there has been some change there. I won't bother to go into this, but we looked at common practices among doctors in terms of how they treated certain infections. Probably the one that I'd wanted to draw your attention to. The top one in the first set is the treatment of, sorry, I can't even see it myself. Diarrhea and vomiting, and you notice that most persons did not give antibiotics. All right, that's yellow. But then look at the fifth, 1, 2, 3, 4, 5, and that one is acute pharyngitis. And you see that you're still having a significant number of persons treating with antibiotics when it may not actually be necessary because most of the cases will probably be viral. And just want to show, continuing in the area of research, that research done at UWI looked at this plant, Callistemon vimnalis, and so extracts from this plant was used against a number of organisms, and we actually saw excellent results, especially against the gram-positives. So who knows? That might be there. I was quite surprised when I realized that I actually had this plant at my gate. So I figured I better keep it. It could be my pension, right? All right, so what are some of the roles that we must have? Development of guidelines for antibiotic usage, that is key. Development of protocols for patient management so that you're not floundering on your own and everybody doing his or her own thing, but that you have an agreement in terms of how to go forward. A national antibiotic policy for us to save the antibiotics. And even if we don't have a national policy, at least do something in your own institution, and at some point we can work towards a national policy. Infection control, as I mentioned before, we really need to police that. And the gains that we have made with COVID, let's try and capitalize on those gains, because I'm sure that persons here have become very aware of hand hygiene, personal protective equipment. Let's not drop our guard now, but let's run it and let's police it so that we continue to behave in the way that we should behave with our patients in order to reduce infections and therefore reduce the use of antibiotics. And of course, reducing the healthcare associated infections in the clinical setting. All right, so in the US, just some points to note, $47 million excess prescriptions each year. At least 30% of antibiotics prescribed in the US are unnecessary. I wonder what our percentage would be. That somebody can study that. 20 to 40% hospitalized patients receive antibiotics. And you do know that sometimes as you're going, you're getting antibiotics and you want to know exactly why am I getting antibiotics? Just take them. All right, 20 to 40% hospitalized patients receive antibiotics. In 2016 in Congress, they gave $160 million to CDC for a national action plan to combat antibiotic resistance. So there is some awareness taking place, and I remember during President Obama's time, he lent a lot of support to the whole development of programs to combat antibiotic resistance, leading to several high-level meetings that then led to international collaboration to do the same. Okay, so what are some of the other things that we can do? I think about the doctors and I say, wake up for those doctors who are not aware of antimicrobial resistance. And those doctors should be in the minority now because the message has been doing its journey around the place. So we need everybody on board and we need everybody having the same message. The doctors need to educate their patients, and I often tell doctors, look, if you explain to your patient why you're not giving them antibiotics, don't just not give them antibiotics, because they will go straight to the doctor next door to you who will give them antibiotics. They will feel better in 2 to 3 days and you will look like a quack. So you tell them from now, look, in 2 to 3 days you will begin to feel better. If you're not feeling better, come back to me, I will see you, I will review you for free. So come back to me in another 2 to 3 days because I expect you to be feeling better by then. You know, you have all the signs, I think it's viral, etc., etc. And then what you need to do now to finish the message, say to them, if you go to another doctor, is this legal? Yeah, if you go to another doctor, the doctor might say to you, here's a prescription for antibiotics. And when you take the antibiotics, you will feel better in another 2 to 3 days. And you will credit the antibiotics with doing that. Now, I'm telling you, you would have felt better anyway, and you would have saved the money for the antibiotics. And so when you get a few converts, they convert others, and then you turn the table on the antibiotic-toting doctor. So after a while, your patients begin to say, do I really need these antibiotics, doctor? And that's a change, as opposed to I want, because patients used to come and say, can I have a prescription for augmentin, or excuse me, what are you going to be using this for? And then you kind of walk them back and you help them to understand that if we use and overuse antibiotics, we're going to get resistance and we're going to lose them. Okay, so then agriculture. Dr. Watson, you have spoken about that. And I want to commend you again also for being further ahead in your national program than we are. And so I would love for the powers that be, anybody here that's reporting to the powers that be, and I'm not speaking to Dr. Dunn or anybody like that in particular, but whoever reports to the powers that be, Dr. Dunn, please let them know that we need some help to get the Ministry of, to get the health section and the human health part of antimicrobial resistance program off the ground as much as possible. The animals are sprinting ahead of us. We can't allow that. So we have put a lot of work in. It's just probably a little tweaking here and there to get us moving all together. Okay, the pharmacists, again, they also have a role to play. We depend on the pharmacists a lot at University Hospital to call and say, I'm seeing a prescription here for ciprofloxacin or some other drug that we have, you know, it's restricted. So you can't just have a prescription for some of these antibiotics going to the pharmacist. And if it does slip through, the pharmacist will call us. Do you know anything about a prescription for Meronem, for Cipro, etc.? Now, what used to happen was that the patient, now not getting the prescription, not getting the drug, would then ask for the prescription and then give a relative to buy the prescription, to fill the prescription outside and bring the drug back. So we have actually tried to intercept that, to cut it off to the best of our ability. It doesn't always work, but at least we're aware of that side chain there. So we rely on our pharmacists as well to help us police what is happening and to intervene where necessary. Talked about the commendation for the poultry industry. The man on the street, we continue to talk and we continue to explain how important it is to take the antibiotics properly, to complete your course. At this point, at least, research is ongoing, but until then, we say take the course of antibiotics. And you don't share antibiotics. It's so common for the neighbor to come and say, you know, this helped me, take 2, I have 2 left. You want them? And that's a perfect way to set up antibiotic resistance. And for the patient, we would say to them, please take your antibiotics as instructed and finish them, complete the course. For teachers everywhere, educate yourself so that you can be a part of the process in educating the persons that you have authority over. And then for infection control, it's so important to have environmental cleaning and to be able to keep your floors, your surfaces, everything that we have learned everything that we have learned in COVID, it's important to maintain. So I freely admit, shamelessly, all I want for Christmas is a germ zapping robot for the University Hospital. This is a robot that is, you know, we went visiting, we're taken to some health facilities in the US, and I fell in love with this robot and will not stop until we get the robot. It's UV, but it's able to cover a wider area, much more trouble-free than some of the things that we have now, and this would be like the cherry on top. So, ladies and gentlemen, I think that's the end of my presentation. Thank you.
Mr. Nicholson, what a wealth of information. Let's see what we're going to do with all of that information. And so, ladies and gentlemen, we don't want to go back to a stage where we are ill and we don't have what to treat us effectively. And so we are going to be encouraged now to be good stewards. So coming to share with us is Dr. Begonia Zagotsky. She is PAHO's advisor for regulatory system strengthening. And so Dr. Stagosta has a 9-year career at PAHO, providing technical cooperation to Caribbean integration entities and to governments of several countries, Belize, Costa Rica, Guatemala, just to name a few. So, ladies and gentlemen, help me welcome Dr. Stagosta.
Thank you very much. I will share my screen now with the presentation. Do let me know if possible if you're hearing me correctly and if the screen has been shared appropriately.
You may proceed, Doc. We can see and we can hear you clearly. Thank you.
Perfect. Much appreciated. Well, thanks for inviting me to be here with you today in this very important commemoration, celebration of the World Antimicrobial Awareness Week. As was presented, my name is Begonia Sagastri. I'm advisor for regulatory system strengthenings, and I'm here in representation of the Medicines and Other Health Technologies unit at the Pan American Health Organization. And it's with pleasure that today we're going to be talking about a very important topic, and I believe that this presentation falls very nicely from what we previously heard from the previous panelists regarding, well, what to do with this challenge, what are the tools that we can use. So that is why we're going to be talking about antimicrobial stewardship and how this allows us to prevent antimicrobial resistance. Now, to get started, it's important for those of you that are not familiar with this term is to really understand what do we mean by antimicrobial stewardship. At least for several laws that come from the public health background, when we talk about the word stewardship, we usually think about this role that the ministries of health have to steer policy. And this is pretty close, the word of what we mean. But in the specific area of antimicrobial resistance, when we talk about AMS, when we talk about antimicrobial stewardship, what we mean is about the existence of a set of coherent and integrated actions that promote the responsible and appropriate use of antimicrobials to help improve patient outcomes across the continuum of care. So here we have a couple of key words that it's important for us to stop by and reflect on. The first is that we're talking about a set of integrated actions. So we have to make sure that it is not individual actions that need to take place in just certain healthcare settings. It is something that, and not only the healthcare, as we were previously seeing, we also in the animal sector. So it needs to be a set of integrated actions, and all of these actions should be promoting responsible and appropriate use. So when we talk about responsible and appropriate use, what we mean here is that first, we need to have a proper and optimized diagnosis. Why are we saying that we need to use an antimicrobial? And then we need to have in place a set of cost-effective measures to use these antimicrobials. So this means only prescribe when they are truly needed. Then you need to select the optimal drug regimen according to the disease that you're treating, but also to the patient that you have in front of you. Not every patient is the same. So you do have to put a lot of care regarding the selection of the optimal drug regimen. drug dosing must be correct, and also the route of administration and duration of the treatment must be correct. So all of this falls within this idea of having a responsible and appropriate use of antimicrobials, but these actions do not only work on their own. We need to have at least 2 additional actions going on throughout the health system in a continuous manner. The first is that we need to have access to safe, affordable, and quality antimicrobials. So this speaks directly about the regulation of the medicines that we're having access to in our countries. And also it speaks about having strong supply chain systems. We need to have access to these safe, affordable, and quality antimicrobials. If we are procuring antimicrobials that do not comply with the specifications that medicines should have, that they're substandard medicines, then we're also contributing to antimicrobial resistance. So this is a very important thing that we need to have in our health system. And additionally, we need to put in place interventions for infection prevention and control. We need to enhance water, sanitation, and hygiene, and optimize vaccination coverage. So this is to set the base of what we're talking about when we're speaking to antimicrobial stewardship. And you'll see that in the upcoming slides, we're going to be concentrating mostly on healthcare settings, notwithstanding that indeed in the animal sector and other sectors, there also needs to be integrated and multi-sectoral approach to the challenge of antimicrobial resistance. But right now we're going to concentrate what can we do? How can we establish antimicrobial stewardship programs in the healthcare settings? So what is the objective of an antimicrobial stewardship program? Indeed, is to optimize the use of antibiotics, and we mentioned, but mostly we have to promote a behavioral change in antimicrobial prescribing and in dispensing practice, because this will definitely lead to an improvement of quality of care and patient outcomes. A couple of weeks ago, there was also the celebration of Patient Safety Day, talking about the importance of having the correct medication. So having definitely an optimized use of antimicrobials also incidence in the healthcare outcomes of our patients. It also provides saving on unnecessary healthcare costs, reduce further emergent selection and spread of antimicrobial resistance, prolong the lifespan of existing antibiotics, and it limits the adverse economic impact of AMR. And all of this has to be done built on the best practices and capacity of healthcare professionals regarding the rational use of antibiotics. So those are the objectives that we should have considered in our AMS programs, but how can we translate this to the practice? Here we have a very nice infographic that we're talking about the existence of 4 clear strategies that had to be included in these AMS programs. The first is having national plans and strategies to address the challenge of AMR, having the appropriate regulation and guidelines, including in these plans activities related to awareness, education, and training, and obviously having the supporting technologies and data to allow us to monitor antimicrobial resistance, antimicrobial consumption, and indeed the successful implementation of our national plans and strategies. Now, I wanted to stop here and just share with you these 2 articles that they're systematic reviews of different antimicrobial stewardship programs. And what we see here is that just the simple fact of establishing an antibiotic stewardship program already has benefits over antimicrobial resistance and the overall health outcomes of our populations. There are several systematic reviews that support the same conclusions, but just sharing this to us, as I think they're very interesting results, the one we've seen. In the first systematic review that we have on the top left of the screen, what we see is that indeed the existence of the program translated in an effective decrease in incidence of Clostridium difficile incidence, and this was particularly important in the hospital and in the hospital settings, but also in geriatric services. So the greatest benefit was observed for geriatric patients. And this is just talking about the existence of the program, because obviously in the systematic review, different programs with different structures were analyzed. So it didn't really matter the structure of the program. It's just the existence of a program that already allows to see direct benefits for patients. And then the second study, that this is a more recent study, this is a 2016 study, we've also been seeing specific decreases in antimicrobial consumption and the costs that are associated in our healthcare settings. For example, we see that having an antimicrobial stewardship program also allows the reduction of overall hospital length of up to 9%. So we do see reductions in hospital stays, we see better outcomes in patients, and all of this also translates in savings for our health systems. Now, what is PAHO doing to support the establishment of AMS programs? There are several activities that are ongoing on PAHO's technical cooperation. The first, and I would say it is one of the most important ones, is that we need to start with a diagnosis. We need to see where we are regarding our antimicrobial consumption, what are our current practices, so we can establish a baseline, and from that baseline, we can create our AMS program to target the specific areas that seem to be more problematic. This is clearly associated to the development of antimicrobial consumption studies. And after we do this diagnosis and we do a complete analysis of the consumption studies, we can develop action plans. And all of this, the diagnosis, but also the action plans, can be done at institutional level, but also at country level. And actually it is promoted that we have them at both levels, because we may have an overarching national policy and identification and plan on how to move forward to tackle antimicrobial resistance, but we need to translate these plans at each individual institution that is participating. Just wanted to put as an example also in the screen, as part of PAHO's technical cooperation, we recently did an analysis in 33 hospitals of 5 countries of the Americas. Unfortunately, of the Caribbean, only Cuba was included as part of this study. And what we're seeing is that overall in the Americas, compared to other similar studies, in other parts of the world, we do see a higher use of antimicrobials, but not only any antimicrobial. We're also seeing some of those that are considered as part of the reserve category. So it is important to start doing work in the Americas, and we need to establish these baselines so that we can monitor our progress. Luckily, in the Caribbean, we already started doing this work. We recently started with Trinidad and Tobago, Guyana, and we have in progress also work with Barbados and St. Kitts. And our first step is establishing this antimicrobial consumption baselines. As part of this recent work, we do expect to have an analysis of what is the situation in the Caribbean so that we can have a concrete strategy. Usually in many of the work and studies that are being done on antimicrobial consumption and the establishment of antimicrobial stewardship programs, we do not have information of what we're doing here in the Caribbean. So we have right now a strategy to do that. We invite institutions and countries to be part of this effort, and these studies are used or are done using the WHO GLASS methodology for surveillance of national antimicrobial consumption, and with the support of one of our collaborating centers, that it's CUFAR, which university in Argentina, that is facilitating all of this process in the Caribbean. We do expect that we will be able, in maybe a year from now, do a specific publication on what's the situation of antimicrobial consumption in the Caribbean region, and we hopefully want to also see reflected the effects that COVID had on antimicrobial consumption in this past couple of years. There are also many available resources that we want to put available to all of you so that you can start establishing your antimicrobial stewardship programs. The first one is the WHO policy guidance on integrated antimicrobial stewardship activities. This policy guideline is extremely useful since it tackles not only the healthcare situation, but also the other sectors and how they should be participating and be part of antimicrobial stewardship programs. And it is based on a set of evidence-based interventions and pragmatic considerations that need to be taken, that need to be in place to establish these programs. And we also have a very useful toolkit on antimicrobial stewardship programs that it's more targeted to specific healthcare facilities in low and middle income countries, where we talk about 6 core components to support a stepwise implementation process of these programs. And the first one is identifying national core elements that should be available throughout all the different plans in all facilities. Then we move to identifying the specific core elements per facility, establish the antimicrobial stewardship programs, perform the interventions, and do the assessment. So you have the whole circle of interventions that should be in place for antimicrobial stewardship programs. And finally, we always have online training. Right now, we have a course hosted on the Open WHO platform, but we do expect also to be offering additional courses in the PAHO virtual campus of public health. So with this, I would like to thank you for inviting us, for having the medicines and other health technologies here with all of you in this very important event. And we look forward to continue collaborating with all countries in the Caribbean to tackle antimicrobial resistance.
Honorable Dr. Norman Dunn unfortunately has to leave us. But Minister, before you go, I just want to say a very big thank you for gracing us with your presence. And it's really good when we can have team leaders like you showing up at events like this to champion the move on our behalf. You know, it says a whole lot. And we really hope that you will continue to do good as it relates to this initiative. We look forward to your support, sir. Blessings. So, ladies and gentlemen, we're coming down nicely. We are going to be making a slight change to our program. And so coming to share with us now is a stalwart of the FSPID, an agency in the Ministry of Industry, Investment and Commerce. This stalwart is actually a food storage scientist in the pesticide residue and mycotoxin unit, and she has been doing this since 2000. This stalwart is now the senior food storage scientist in the unit, but she has a wealth of experience as she has served as a deputy food storage officer and the chief food storage officer. Today, she is also a member of the National Codex Committee. And for that, we want to say a big welcome to Mrs. Tamara Moore.
All right, good. Is it still morning? All right, good afternoon, everyone. All protocols observed. Can someone bring up the present? Okay, thank you. All right, today I'll be presenting on the food storage division and what we do at the division and the implications of pesticide residues on health and trade. Or the FSPID, the Food Storage and Prevention of Infestation Division, was founded in 1958 and it operates under the FSPI Act of 1958 and the regulations of 1973, and recently in 2019 our Act and regulations were updated. The FSPID serves to ensure food safety and wholesomeness and also to assist food establishments in mitigating food loss. Our functions, we have an inspectorate unit, and one of the main functions is inspection, and the inspectorate unit will sample where that is necessary. and they also carry out disinfestation operations and disposal of food. Actually, food and feed. We analyze food for contamination and infestation, and we also have a training unit, so we do training and information dissemination. Our inspectorate unit, the inspectorate and disinfestation unit, is the foreline of the division, and the inspections are conducted in order to determine compliance with our act and regulations. If breaches are found, then we issue statutory notices, and if necessary, the food or the premises would be detained and the food disposed of. When found to be in compliance, food establishments are issued a certificate of compliance. In 2019, our Inspectorate and Disinfestation Unit was accredited to the ISO IEC 17020 International Standard for the inspection of food in shipping containers, in premises, and on ships. And this is a very notable achievement, and this was done through JANAC. Supporting our inspectorate unit would be the FSPID laboratory units. We have 4 testing laboratories and 1 research laboratory. So the 4 testing laboratories are the pesticide residue and mycotoxin unit, the microbiology unit, entomology, rodent biology and control, and our research unit is the post-harvest technology unit. The pesticide residue and mycotoxin unit. This laboratory unit conducts analyses on foods, including fruits and vegetables, and feeds for pesticide residues and the mycotoxins. The microbiology unit. This unit conducts analyses for fungi and bacteria to ensure that food meets standards and requirements with regard to microbial contamination. The entomology unit ensures the wholesomeness of durable food by analyzing for insects, insect fragments, moisture content, and extraneous matter, and they also conduct insect identification. The rodent biology and control unit. This laboratory is responsible for reducing rodent populations in and around food facilities and also conducts bioassays of rodenticides. So our research lab is the post-harvest technology unit, and it has the responsibility of conducting inspections. This would be like inspections of supermarkets, and they also do research and disseminating information regarding reduction of post-harvest loss of perishable commodities entering commerce. At the FSPID, testing is conducted for regulatory purposes. Our main function is regulatory, but we also do testing for private customers, and this would also include exporters. The Training and Information Unit provides training and information in integrated pest management, food storage, handling, and transportation. Certification training is also conducted for pest control operators. Recently, we have achieved ISO 9001 certification, and this was in July this year, and we're certified to the ISO 9001 2015 International Standard for its disinfestation and training dissemination services. As it relates to contamination of food, contamination with pesticide residues other chemicals as well as microorganisms can have implications on consumers' health and or exports. For implications of pesticide maximum residue limits on trade, it is important to be aware of pesticide maximum residue limits to avoid import violations. And just to a maximum residue limit is a legal limit that would be set as to the maximum amount of a pesticide that would be allowed in a particular food commodity. And to know, well, to be aware of these MRLs, it's important so that we protect, our country's reputation and to protect the market for a particular crop. Because it has happened, or it can happen as well, where if a commodity is intercepted by another country for a MRL violation, that can also affect other companies wishing to export that similar crop. And to avoid this, it is important for exporters to know the requirements of the importing country. Different countries would have different requirements. We know, for example, the European Union would have more stringent requirements as it relates to pesticide residues on certain food commodities. And ensure that only the specified chemical is used on the particular crop. Important also to ensure that the withdrawal period for pesticide use is observed. In 1976, just to highlight the importance of protecting our food from heavy pesticide use, in 1976, 64 persons in St. Thomas became ill after consuming food made with imported counterflour, and this was accidentally contaminated with parathion. At that time, the flour was shipped in the same container that parathion was previously shipped in, and so the contamination occurred. So our act and regulations actually speak to how food should be transported. Of course, I think by this, we all know you don't store food and pesticides together, or if something had pesticide before, you don't, put food in that area. Unfortunately, in that situation, 17 persons died. Okay, I did mention this. So the desired outcomes for the FSPID is that we have a safe and wholesome food, and of course that would translate to a healthy population. And if we follow the guidelines and proper use of pesticides and proper storage practices, then this would lead to increased access to international markets. So that concludes this presentation, and just to let you know, our main office is just around the corner, just outside of Pepin Square. That's the main office, and we also have an office in Montego Bay, where we have a small cadre of inspectors that would service the western end of the division, the island. All right, so thank you.
Thank you, Mrs. Moore, for sharing the role of the FSPID in this initiative. Ladies and gentlemen, I know how you must be feeling right now. It's some minutes after 12 o'clock, right? Yes. So we're going to quickly wrap up our session for this afternoon. But before we do so, I have a giveaway just for you, and we're going to do it in a fun way. Ready? Quick, and we're out of here in record time. So I'm going to ask my wonderful friends on the outside just to share quickly. You need your smartphones for this exercise. You're going to log on for me to a particular website, it requires quick fingers. And if you were listening to Dr. Peters, if you were listening to Dr. Nicholson, then this should not be so hard at all. So, we're just waiting for friends just to share. Let's see if you were paying attention during these presentations. Let's see if Dr. Nicholson was a good teacher today. Let's see if Dr. Peters really gave you something to think about. So we're just waiting for our friends just to share quickly. Excellent. So log on, my friends, to www.kahoot.it. Let's do that again. Log on to www.k as in king, A as in apple, H as in happy, O as in orange, O again as in orange, T as in tree, .it. And then that will ask you for a game pin. The game pin is 17494446. So to my friends online, you can join, and I will arrange for your prize, if you so win, to be delivered to you. So it asks you for your name. Quickly just put in a nickname, and let's see how much you have learned today. Just one question. Just a minute more. All right, so we see TM. I see NCRA. I see Osbill. That must be you, Dr. Watson. I see Trisha, Jerry, Alva, KAMR. Wow. Steph, Janine, Ian, Neil, Mishka. Mishka, that sounds like Dr. Mishka Stennett. She's joining online. Excellent. Orain, thank you for coming. Serene. Who else? One more minute? All right, let's close the show. So, we're going to now ask this one question. It requires of you to quick fingers, right? So, you're going to look on the screen. It's going to show you the question. Read the question carefully. This is something teachers tell the students all the time. Read the instructions carefully. So I will say to you, read the question carefully. Then, on your smartphone, you're going to click the color representing the answer. YouTube. Be patient. It's coming. It's coming. All right? So, on your mark, set, start. Okay. Here's your question. One question. Ready? Antibiotics are used to treat what? Fungi, virus, bacteria, or all of the above? Wow, 12 already. Whoa, 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 you're going nicely, man. Great. 9 seconds to go. Come on. The first person to get this is going to be our champion. And that person is, so 14 persons out of all who participating today got it correctly. Antibiotics are used to treat bacteria, not viruses, not fungi, but bacteria. Good. So, can you click next for me, please? Let's see who the winner is. Well, in third place, Neil. Good job, Neil. Second place, Steph. Woo! And in first place, we have Jerry. Woo! Who's Jerry? Is Jerry inside here? Oh, come up here, Jerry. Wonderful. Jerry is our champion. And Dr. Serene Joseph is going to be the person just to present to Jerry, who had quick fingers. Jerry was listening to Dr. Nicholson. Jerry was listening to Dr. Peters. Congratulations. And this prize, turn it around for me, is compliments of our sponsor, CB Group. Give CB a round of applause, rather. Excellent. Congratulations, Jerry. Excellent. Wonderful. So, ladies and gentlemen, I want one person, quick, who can come right in front of me. Quick. Just one person. One person. Wonderful. Thank you for coming. So I'm going to ask of you to share 3 takeaways from any of our presenters. 3 takeaways. Come beside me so that everybody can hear you. 3 takeaways.
Don't ask for antibiotics when you go to the doctor. That's the first one. Still practice your COVID hygiene, because as we can see what happened with Professor Nicholson when she shook hands, right? So a lot of us held on to the door handle, right? And the third, just not awareness. Well, okay, so we are not to share medication over, well, that's it. That's 3.
Wonderful. Congratulations. This is Mrs. Mallet, a member of the team at Veterinary Services. Mr. Steen, would it be so nice just to make the presentation for us?
Good job.
And again, we want to say a big thank you to the CB Group for this wonderful prize. Congratulations, Mrs. Mallet. So, ladies and gentlemen, we are now complete with our program, but I must say, first of all, that this has been a wonderful celebration. Jamaica is certainly doing a lot when it comes on to AMR. We just need to tighten a few things. Currently, you would have heard that we have a multi-sectorial group putting together Jamaica's National Action Plan for Antimicrobial Resistance, and this team comprises members from the Ministry of Health and Wellness, Ministry of Agriculture and Fisheries, the Ministry of Industry, Investment and Commerce, our kind support partners, Pan American Health Organization, the Inter-American Institute for Cooperation on Agriculture, ICA, and of course the FAO, Food and Agriculture Organization. So this is not a one-man show. This requires a One Health approach, and everybody has to join hands and hearts and efforts together in promoting good stewardship of our antimicrobials. So, ladies and gentlemen, with this we close the pages of what was a wonderful 2022 celebration for World Antimicrobial Awareness Week. Special thanks to our sponsors, the CB Group. And I would also like to say a very big thank you to our speakers and our presenters who took the time out just to enlighten us about what AMR is and our role as it relates to this phenomenon. Thanks to the teammates from JIS who provided streaming services for us today. Thanks again to the team from the Pan American Health Organization. They did a wonderful job in getting this exercise underway today. Put your hands together for all our speakers, presenters, our sponsors, and members of the multi-sectorial group. Thank you so much. With that, ladies and gentlemen, I invite everyone just to stay true, be prudent users of antimicrobials. Blessings and one love.
Lately, many things have changed. The way we greet each other, our personal items, meetings with friends. We changed, of course, but we're still the same. During this pandemic, information is our main partner. That's why today, let's talk about resistance to antimicrobial agents and COVID-19. Used to treat body infections are called antimicrobials. But if you take them when it's not appropriate, they lose their efficacy, and when the time comes that you really need them, they will no longer be useful. This phenomenon is called AMR, antimicrobial resistance. The most widely known antimicrobials are called antibiotics, but they are useless to fight diseases such as COVID-19 because it is caused by a virus, whereas antibiotics cure diseases of bacterial origin. Therefore, if you feel sick, do not self-medicate. Consult a health professional qualified to write a prescription and take antibiotics only when prescribed. COVID-19 and antimicrobial resistance. Key information for a better world. As their opponents must be unaware of their upcoming movements. If we take these drugs when they have not been prescribed, we are inflicting a potential problem to our body, and when the true threat comes, these drugs will be less effective. This phenomenon is called AMR, antimicrobial resistance, which means that the drug is no longer effective against that microbe. Antimicrobial resistance can be prevented if we avoid self-medication and early treatment discontinuation, and also if we avoid eating food products of animal and plant origin containing antimicrobial drugs. Resistance to antimicrobial agents poses an ever-growing threat to public health around the world and calls for urgent measures. Help in upholding the efficacy of antimicrobial agents by using them only when prescribed by a qualified professional. Talk to your relatives and friends about the importance of a proper use of these agents and the problem derived from antimicrobial resistance.